Vital statistics include all except migration, false answer, birth, death, morbidity, marriage. Examples of tertiary prevention are: to answer, early physiotherapy to an affected limb, laser therapy to prevent blindness in diabetes mellitus. False answer, vaccination against rabies, early treatment, environmental sanitation. Following methods are two-way communications. True answer, group discussion, symposium, panel discussion. False answer, lecture, seminar. Causes of high fertility rate in Bangladesh are: true answer, early age at marriage, low rate of literacy, poor level of living. False answer, poor health facilities, high population density. Vitamin A is needed for, true answer, growth, normal skin, normal vision, for brain development. False answer, prevention of scurvy. The components of comprehensive health care are: true answer, preventive, promotive, rehabilitative. False answer, mental, psychological. Examples of non-communicable diseases are: true answer, diabetes mellitus, coronary heart disease. False answer, malnutrition, AIDS, measles. Secondary prevention can be done by, true answer, early diagnosis, adequate treatment. False answer, specific protection, disability limitation, health promotion. Vertically transmitted disease, true answer, viral hepatitis B, human immunodeficiency virus infection. False answer, poliomyelitis, Escherichia coli, diarrhea, cholera. Inorganic pollutants are: true answer, fluorides, mercury, sulfur dioxide. False answer, plastic oil. Disposal of waste in hospital is done in the following ways. True answer, recyclable plastic waste in green bin, liquid waste in blue bin, sharp waste in yellow bin. True answer, recyclable plastic waste in green bin, liquid waste in blue bin. False answer, general waste in black bin, infection solid waste in red bin, sharp waste in yellow bin. The major greenhouse gases are carbon dioxide, methane, CFC. False answer, helium, smoke. Pneumoconiosis is caused by, true answer, coal dust, silica, asbestos. False answer, chromium, mercury. Non-auditory effects of noise on human health are: true answer, palpitation, fatigue. False answer, tinnitus, peptic ulcer, temporary hearing loss. Occupational hazard related to cold are: chilblains, frostbite, trench foot. False answer, malformation, Caisson's disease. Door-to-door health services are delivered by, true answer, health assistant, female welfare assistant. False answer, medical assistant, pharmacist, Upazila health and family planning officer. The following rates are the morbidity indicators. True answer, spell of sickness, for hospital admission rate. False answer, infant mortality rate, bed occupancy rate, population increase rate. Which of these are not methods of data collection? True answer, regression. False answer, questionnaire, experiments, observation, review records. The which p-value are considered statistically significant? 0.05 or 0.001. False answer, 0.07, 0.1, 0.5. A snapshot study is the other name of the following studies. It is an answer of a cross-sectional study. False answer, survey, case control study, clinical trial, follow-up study. Components of epidemiology are: disease frequency, distribution, determinants. False answer, demography, hospital management. Basic components of reproductive health include safe motherhood, adolescent reproductive health. False answer, medicine, family medicine, road traffic accident, responsible parenthood. Following are the direct causes of maternal death. For true answer, hemorrhage, obstructed labor. False answer, antenatal hepatitis, gestational diabetes, pregnancy induced hypertension. Common cause of neonatal mortality in Bangladesh. True answer, acute diarrhea, premature birth, infection. False answer, severe jaundice, birth asphyxia. Which are the factors contribute to high risk pregnancy in, true answer, age less than 20 or more than 30 years. False answer, first or fourth pregnancy, birth interval less than 2 years, inadequate rest during daytime, height less than 145 centimeter or 58 inches. Which statements are true for hepatitis in pregnancy? Liver failure, enlarged liver, cirrhosis of liver. False answer, antepartum hemorrhage, postpartum hemorrhage. Indications of MDG 4 are true answer: infant mortality rate, proportion of 1-year-old children immunized against measles, child mortality rate, under 5 mortality rate. False answer: proportion of 1-year-old children immunized against EPI diseases. Gender equality means true answer: both men and women have equal opportunities and responsibilities. Fairness and justice in the distribution of benefits and responsibilities between men and women. The species needs of particular group are considered separately and acted upon accordingly. False answer: the socio-cultural difference between men and women, biological similarities between men and women. Objectives of surveillance are true answer: epidemic prediction, estimation of future disease impact, monitoring disease trend. False answer: sporadic detection, periodic health examination. Common risk behaviors among adolescents are true answer: substance abuse, sexual risk behavior. False answer: frequent hangout program, suicidal behavior, opportunistic relationship. Smoking, antisocial behavior, hazardous alcohol consumption, unprotected sexual intercourse. The advantages of group decision making are true answer: more information obtained, more acceptance gained, more alternatives gained. False answer: more time required, more subscription required. Analytical studies include true answer: cohort study, case control study. False answer: case report, descriptive study, case series. Disease frequency measurements are true answer: incidence rate, prevalence rate. False answer: fertility rate, attack rate, case fatality rate. Depending on the arsenic level in water, tube wells are marked with following colors: red, green. The following are the waterborne diseases: true answer: typhoid, cholera, diarrhea. False answer: diabetes mellitus, tetanus. The following are the components of essential service package: true answer: antenatal care, family planning, behavior change, communication. False answer: diabetes care, critical care. Pentavalent vaccines is given for protection against following diseases: true answer: tetanus, diphtheria. False answer: poliomyelitis, measles, chickenpox. Active immunity can be acquired by the following: true answer: inoculation with live or killed vaccine, inoculation with live or killed vaccine, inoculation with toxoid, exposure to infectious agent. False answer: inoculation with immune serum, colostrum feeding. Which of the following dimensions are not included in the definition of health according World Health Organization? True answer: occupational, medical. False answer: mental, social, spiritual. Which of the following dimensions are not included in the definition of health according to WHO? True answer for true answer of occupational, spiritual, medical. An ideal health indicator should be true answer: sensible, reliable, feasible. False answer: universal, socially acceptable. Steps of planning a true answer: programming, monitoring, budgeting. False answer: decision making, motivating. Steps of decision making are true answer: planning, listing alternate solutions, defining problem, choosing the best alternatives. False answer: setting performance standard. Features of oral polio vaccine include true answer: provide intestinal immunity, provide humoral immunity, contraindicated in pregnancy, live attenuated vaccine. False answer: not efficacious for polio epidemic. Physical dependence is produced by true answer: heroin, cocaine, alcohol, barbiturate, methadone. Sample registration system true answer: denotes dual record system, covers part of the country, includes segments of population, ensures enumerates birth and death continuously, conducts independent survey every 6 months. Disease transmitted by droplet nuclei are true answer: influenza, chickenpox. False answer: anthrax, tetanus, Q fever. Subclinical infection occurs in true answer: mumps, rubella, measles, herpes simplex. False answer: diphtheria. Rubella, mumps, polio, hepatitis A virus, B virus, Japanese encephalitis, influenza, diphtheria. Characteristics of non-communicable disease are true answer: long incubation period, multifactorial causation, irreversible pathological change. False answer: definite onset, defined etiological agent. Commonly used epidemiological indices for tuberculosis are true answer: prevalence of infection, incidence of disease, BCG vaccination coverage, DOTS coverage. False answer: annual infection rate. Following personnel provide services from community clinics. True answer: health assistant, community health care provider, family welfare assistant. False answer: medical assistant, family welfare visitor. Following are the hospital utilization indicators. True answer: hospital admission rate, bed occupancy rate, average length of stay. False answer: case fatality rate, infant mortality rate. Following are the diseases due to vitamin D deficiency. True answer: rickets, osteomalacia. False answer: scurvy, goiter, filariasis. Following are the Measures of central tendency to answer median, percentile, mode, false answer, variance range. Following are the examples of biases in epidemiological studies to answer recall selection, false answer control by blinding measurement. Bias ভিতরে types of bias due to confounding memory or recall bias, selection bias, Bergsonian bias, interviewers bias. Primary health care are mainly provided from Upazila Health Complex, Community Clinic, Union Health Sub-Center, Falls Answer District Hospital, Medical College Hospital. Which of the following are example of quantitative data? True answer diastolic blood pressure, death or alive age. False answer nationality, gender. Basic epidemiological tools are true answer rate, proportion, ratio. False answer mean, median. Following are the emerging diseases. True answer Nipah, chikungunya. False answer cholera, typhoid fever, anthrax. Emerging rog AIDS, Ebola, Mars virus, SARS virus, avian influenza, bird flu, swine flu, chikungunya, Nipah virus infection, Marburg. Re-emerging polio, dengue, filaria, kalajar, malaria, enteric fever, typhoid, paratyphoid, plague, viral hepatitis, anthrax. The following are the characteristics of a true experimental study. True answer randomization, control. False answer manipulation, observation, hypothesis, formulation. A square minus b square equals to a plus b into a minus b, a square minus 2ab plus 2ab minus b square. First answer a square plus 2b plus b square, a square minus 2ab plus b cube, a plus b whole square. The following are the measures of dispersion. True answer standard deviation, coefficient of variation. False answer mode, percentile, quartile. Which of the following are considered as primary prevention? Immunization, risk reduction. False answer screening program, early treatment, prevention of reoccurrence. The following are the modifiable risk factors of coronary heart disease. True answer obesity, moderate alcohol intake, dyslipidemia. False answer genetic factor, older age. The following are the physical resources for management. True answer man, money, material. False answer motivation, monitoring. Disaster is considered as true answer occurrence without warning, man-made event, a natural event, outside response. False answer all hazard. Functions of district hospital public health nurse are true answer supervising nurses in Upazila Health Complex, teaching nursing students. False answer planning activities in civil surgeon office, conducting hospital audit, managing critical patients at outpatient department. Disaster is considered as true answer occurrence without warning, man-made event, natural event, outside response, all hazard. Disaster is considered as occurrence without warning, man-made event, natural event, outside response. False answer all hazards. Observational studies include descriptive studies, analytic studies, cohort studies. False answer randomized control trial, community trial. The hierarchy of human needs included in motivation are physiological needs, safety needs, self-esteem needs. False answer economical needs, cultural needs. Abraham Maslow's need hierarchy. এটার ভিতর কি আছে সেলফ অ্যাকচুয়ালাইজেশন, esteem, love or belonging, safety, physiological. Indicators of quality of life are infant mortality, life expectancy at age 1, literacy. False answer infant morbidity, maternal mortality. Non-verbal communication includes true answer shrugging shoulder, pointing finger, tapping on the table. False answer giving lecture, talking over telephone. Group method of teaching are true answer demonstration, panel discussion, symposium. False answer interview, public speech. The objectives of health education are true answer learning, informing people, motivating people, counseling, guiding into action. The elements of communication are true answer receiver, feedback, sender. False answer talking, responding. Communication process sender, receiver, message, channel, feedback. Changing concepts of public health. Changing concept of health include ecological concept, psychosocial concept. False answer is spiritual concept, health promotion concept, health for all concept. Incubation period of rabies depends on species of biting animal, modes of transmission, severity of bite, site of bite, host immunity. Incubation period of rabies depends on true answer species of biting animal, mode of transmission, severity of bite, site of bite, host immunity. Disease transmitted by vectors are true answer malaria, dengue, false answer anthrax, influenza, chicken pox. The following are the viral diseases. True answer mumps, measles, herpes simplex. False answer tetanus, diphtheria. Components of integrated management of childhood illness are true answer improvement of health workers' skill, the improvement of health system, improvement of family and community practices. False answer improvement of health care delivery, improvement of physician's skill. The following are the vitamin B complex. True answer folic acid, niacin, pyridoxine. False answer zinc, retinol. The indicators of health services are true answer doctor patient ratio, doctor nurse ratio, bed population ratio. False answer child mother ratio, disease specific metabolic ratio. Disease specific metabolic ratio.